Hello everyone, my name is Ken and today we're going to talk about the Emapalumab in children with primary hemophagocytic lymphohistocytosis. The definition is primary hemophagocytosis lymphohistocytosis is a rare syndrome characterized by immune dysregulation and hyperinflammation. It typically manifests in infancy and is associated with high mortality.
Hemophagocytic lymphohistiocytosis is defined as a life-threatening hyperinflammatory condition due to activation of macrophages and increased cytokine production, resulting in multi-system manifestations. This is a schematic diagram of a macrophage or antigen-presenting cell. In the presence of an antigen, the macrophage gets activated. Once its function of presenting the antigen to the T cell is over, it is generally lysed by the CD8 cytotoxic T cell. Similarly, natural killer cell also function to deactivate the activated macrophages or antigen-presenting cells. In hemophagocytic lymphohistiocytosis, there is a defect in T cell function and natural killer cell function. There is increased cytokine production, which results in hypercytokinemia, which is responsible for tissue damage. In absence of these
Now, application in medicine. Emapalumab is a human monoclonal antibody to interferon gamma which acts to block it binding to cell-surface receptor and activation on inflammatory signals. Emapalumab is used to treat the severe inflammatory syndrome.
Hemophagocytic lymphohistiocytosis, HLH, is a severe syndrome of hyperinflammation driven by massive overexpression of interferon gamma. This photomicrograph shows the pathology after which the HLH syndrome is named. The large cell is an activated macrophage engaged in hemophagocytosis. Primary HLH, one form of the disorder, is caused by mutations in genes encoding proteins involved in the cytotoxicity of T lymphocytes and natural killer cells. In healthy individuals, during defense against infections, cytotoxic CD8 positive cells recognize and bind to antigen-presenting cells, and then release perforin and granzymes into the immunological space. Perforin creates pores in the target cell's plasma membrane, allowing entry of cytotoxic granzymes causing cell lysis. Patients with
Pros and cons. Pros. Emapalumab is used to treat the severe inflammatory condition of hemophagocytic lymphohistiocytosis in which serum gamma interferon levels are elevated. Cons. Some side effects of the drugs are constipation, fever, irregular heartbeat, and others.
To talk to you about targeting cytokines. And if you talk about SGIA, you have heard a lot about targeting IL-1 and IL-6. And the first things I want to simply say is that you actually do not eliminate completely the risk of MAS, even in patients in which IL-1 and IL-6 are inhibited. This is the rate of probable or definitive MAS adjudicated events in the 2 development program of canakinumab tocilizumab. And you see that the incidence rate is still pretty evident there. What about IL-1 inhibitions? There is evidence of efficacy of anakinra in at least some cases of patients with MAS. You have to use high dose. There is some evidence of resolution of MAS on high dose canakinumab, but there is also the opposite. Case reports of MAS reported as triggered, dotted and question marked by anakinra. I think this is simply patients that were treated with anakinra that develop MAS because the disease was not sufficiently controlled. I don't think that anakinra can trigger MAS, certainly. And the same is somehow true with IL-6. There are some responses of good response, and certainly the cytokine storm that
Issue applied in Ecuador. The hemophagocytosis syndrome is a rare entity which is most commonly seen in children, but can be found at any age. It consists of a combination of cytologically benign proliferation of activated macrophages in bone marrow, spleen, liver, or lymph nodes associated with fever, cytopenia, splenomegaly, and hypertriglyceridemia.
Inhibitions. There is evidence of efficacy of anakinra in at least some cases of patients with MAS. You have to use high.
Finally, we have the conclusion. Emapalumab was an efficacious target therapy for patients with primary hemophagocytic lymphohistiocytosis.
HLH is hemophagocytic lymphohistiocytosis. I'll call it HLH moving forward. And you get two types of HLH, primary and secondary. And what HLH is it's a hyperimmune, hyperinflammatory syndrome where a patient will present, very often a pediatric patient, will present with a number of signs and symptoms and laboratory abnormalities. And it's very severe, and in many cases these patients die from their disease. So they'll present with high fever, they'll present with a number of enlargements in different organs like the liver and the spleen. Their blood will be out of whack. They'll have very high levels of pro-inflammatory cytokines. They'll have low levels of platelets and white blood cells and red blood cells, which cause a number of problems. They'll have very high levels of ferritin, which indicates a hyperinflammatory state. And the objective here is to stabilize these patients.